Health benefits. They're a headache, whether you're an employer or an employee. Out-of-pocket costs, deductibles, co-pays, each another reason to avoid going to the doctor. But why does it have to be this way? At Gravie, we don't think it does. We're reimagining the employer-sponsored health benefits market, showing how small and mid-sized businesses can punch above their weight with benefits plans employees will want to use. We even think they'll love them. On It's a Gravy Thing, we'll explore existing and upcoming innovations in the health benefits space, improving the ways small and mid-sized businesses provide affordable healthcare coverage to their employees. We'll hear from experts on what works, what doesn't, and what changes they'd like to see. Medical underwriting is both the linchpin of health benefits and the biggest obstacle. For many employers, underwriting feels like a mysterious process with little visibility, but it can make or break their ability to offer coverage to their employees. While much of how group health benefits are designed and paid for has evolved over time, there has been very little innovation in the underwriting process over the years. Here's the thing. For traditional plans, underwriting has largely been a uniform affair, even if the companies being underwritten aren't. Emerging plans are flipping the script. They're exploring ways the underwriting process can better assess individual risk, provide coverage for groups that otherwise might not be able to afford coverage, and help employers better predict their costs. For this episode of It's a Gravy Thing, we're getting the inside perspective. We have Sheehy, Gravie's Chief Underwriting Officer, and Jalaa Miller, an account executive for employee benefits at the IMA Financial Group. So, let's get into it. Well, Jalaa, I'm really glad that you guys are here and we can have we'll make this a fun conversation out of something that other people might not have as much fun talking about, underwriting. But of course, in our business, that's the price of entry. And, as we were talking about before we sat down here, I'm taken by the idea that medical underwriting is both the linchpin to health benefits and perhaps one of the biggest obstacles to, being able to influence premiums, rates, coverage in general. Jay, I'd be curious from your perspective, you've been working in this business for a very long time. Where were we? Where have we been when it comes to underwriting? And how has the traditional approach to underwriting not served the industry and all of us in and around it?
Well, going back in time, even the fiche machines, when you're printing off reams of paper to look at experience on customers, we have come a long way. But it was always a retrospective, conservative view of where a company had been, where their risk was previously, and not where the risk was going, particularly with the evolution of plan designs and clinical programs and other innovative reasons to really drive better healthcare. So we had to evolve because things were really just looking in the rearview mirror, not looking forward to where the customers and the risk could be going in the future.
And I guess what you make me think of that is that now when you look at underwriting, and if you take more of a future focused perspective, you can think about ways that underwriting should go hand in hand with clinical navigation programs, with other ways that payers have the opportunity to affect behaviors. And so it sounds like underwriting didn't keep up with the evolution of plan designs in some ways.
They really didn't. Back in the day, you had cafeteria plans where you were trying to put modules together and you made it very complex for the people who were least knowledgeable on choosing health plans, and that's the employers and the employees. Now where we're evolving to is how do you help them understand how to optimize their health as a member, and also how you get the employer to optimize their financial well-being in a sustainable approach. So it really is changing the dynamic to moving forward and being very proactive the way a financial advisor would advise you. Many people don't go out and choose their own stocks. They choose someone who is experienced, like a Jalaa, who helps advise them in how to make the right choices based upon where they are in their career and family life to optimize their financial well-being. We want to sort of do the same thing for healthcare. What programs and plan designs would optimize the health of your family and the sustainability of the financial arrangement for the employer, particularly in the small and middle market, where they really don't get the sophisticated attention except for advisors.
Well, in particularly in the smaller market, I think the whole idea of underwriting is terrifying to an employer or to a benefits consultant, because there's only so many people among whom that risk can be spread. So, Jay, I'm curious. I know that we have an approach at Gravie that we like to refer to as surgical underwriting. If you could just define what Gravie means when we say that our approach to underwriting is surgical.
So we trademarked the term surgical underwriting because it is that very forward-looking perspective. And what that means is we get very much into the details of the risk of the members, and not, again, where it has been historically. It's where it's going to be in the future. So let me give you an example. If you're looking at high-cost claims, many people look at what's happened in the past. You've had these major conditions, and then people move that risk forward. What we're looking at is exactly what was the condition. So if you had your appendix out, you only have one appendix. So that condition's not going to move forward. If you have a cancer condition, prostate or breast cancer, where are you in the treatment plan? Not where have you been, but where are you going, and what are the clinical programs, and what is the cost for where it is going to be, and price to that point in where the care is going to be, which is a much more defendable, knowledgeable, explainable approach for many employers, particularly in the small and middle market segment.
Well, and as a consultant, that's very easy to explain to a client. We have looked at, the carrier we're with has looked at all of your high-cost claimants. Here's what they're seeing. Here's what we know to expect. Whereas with other, carriers or other methodologies, sometimes it's a trend rate, and it's really hard to describe trend, because that could be anything, really, because everything's changing so quickly. So I appreciate that approach just because it helps me be a better advisor to my clients.
So how does it change the way you work with your clients? How does working with an organization like Gravie in a different approach to underwriting change the way you might work with clients who are with other carriers?
Well, it's always data focused, right? So throughout the entire year, it's not just like at renewal, here's your what you're going to get, and let's, hope for the best next year. We are looking at the risk on the plan from the first couple of months into the plan, and having strategy conversations about, okay, here's what's coming up. Small employer, we have 75 people on the plan. This could have a big kind of volatility piece to this unless we know what's going on. And so it's keeping them prepared so that when a renewal comes, one, it's not a surprise, but two, we've already started having conversations about point solutions that could potentially help. Is there anything, from the carrier perspective that you're seeing in the market that we might be able to introduce to our client, and really coming at it as a partnership so that we're best serving our mutual clients?
Jay, do you have any sense of what kind of impact our approach to underwriting has had on some small and mid-sized employers who previously were with other groups? I mean, have we been able to, are people getting coverage that they couldn't get before? Are they seeing fewer and smaller rate increases? Are they seeing a rate cap more frequently? How is surgical underwriting translating into value for our employer clients?
The whole approach is, along with our risk models and probability models, is to provide a sustainable approach for small and mid-market customers, meaning that predictability, trying to avoid surprises, or when something happens, have other solutions for them, as well as the ability to really be transparent and explain it to them in a simplified way, as Jalaa mentioned. what it has done for us, it's allowed us to really drive to the center of the dartboard. We're really trying to drive to that accuracy and really understand where the risk is going, even on volatile, smaller cases. So it allows us to really bring a better solution with our comfort products, which are higher value products, to an underserved sort of segment of the business community on a very sustainable, predictable approach. Does it work perfectly? Not always, because there will always be some very catastrophic claims where the best solution may be a fully insured solution
Sure.
in the marketplace. But we have been able to deliver industry-leading persistency on our customers. We have outperformed on trend and average rate increases, what you see in the marketplace, and we've had very strong year-over-year growth rates. So it's not just about selling the business. It's about that sustainability, because these employers need that predictability. And you're often dealing with individuals who are the president or the CFO of the company, who also wear the HR hat, who also do
Yeah,
other
in a smaller
jobs,
business, they
right?
do everything.
Yeah. So how do you really help them understand and have confidence? And in that situation, we do provide rate caps. Part of it is to prove our confidence in how we've rated the business to both them and to their advisors, but also to differentiate Gravie in the marketplace.
Is there greater or less burden on the employer to provide information the way that Gravie's underwriting approach works, or is it basically the same?
I mean, it's basically the same. I would ask the same questions of any carrier,
Okay.
right? Like, or take the information I have back to any carrier. So I think it's because from my perspective, I am helping to meet the goals of the employer, right? Whatever those goals were that we set out at strategy, whether that be a financial goal, whether it be a plan design goal, and looking for a richer benefit for their employees. So whatever I need to do to help my clients get to those goals, that's how I'm going to approach the conversations around renewal and the underwriting. And, if we're bringing new point solutions to the table, then it's going back to the carrier to say, hey, we are adding this outside of the plan. Can you give me decrement here? Because this could potentially help the risk that we're seeing on the plan.
One of the things I think we try to do a little bit differently, based upon what Jalaa was saying, is we do want to be transparent and share the information and why we do stuff. When we ask for data, and we do ask for a lot of data, because it helps us be much more accurate in how we approach the risk. But then we share why we did it and what the results are. We don't keep it in a black box. We want the employer and the advisor to, whether it's good or bad, they need to know. Yes. And how we've done that. And it creates a level of trust that I don't see often in the industry. And it helps us get to better answers and disagree sometimes. Having a good conversation educates people, and it helps us get to better answers sometimes, because often the advisors know a lot more about the customer, that when we open up those conversations, we learn this person's at this point in their care. And it helps us, again, if you have that transparency and you have the confidence to share, you help each other and you truly partner and get to a better answer. Whether that answer is the best for the customer is the customer has to decide based upon the advice of the advisor. But
Sure.
You have to build that trust, because it's not just about one employer, it's about all the employers we serve or would like to serve.
At the end of the day, the client just wants to understand why.
why they're being charged this.
Why they're being
my
charged
rates
this,
more?
why is this happening? And, if I can't explain that to them, then I'm not doing my job as an advisor. And so that's where I appreciate partnerships like what we have with Gravie, because I can ask specific questions and get to the why of the issue. And that also gives me the leverage to then plan for it for future, right?
Yeah, I mean, I think people have this image of health benefits companies and their underwriters in this ivory tower where they, as you said, Jay, like they're entering data and they're crunching numbers, and whatever spits out is the answer without any communication, without any critical thinking. And I think what you've demonstrated is by working together, Jay and Jalaa, is that like it is a collaborative process, that underwriting shouldn't ever feel like here's what the machine said, tell your clients, and instead it should be let's look at this differently. Let's think about this together. Let's see what levers we can pull, because at the end of the day, we're all trying to serve the same people.
Well, where I want underwriters to go is really, it's a balance of machines and humans, right? The machines can do a lot of cool stuff, right? They can do intelligent data processing where they load the data in, where it makes you more efficient and more accurate. And the machines can run 300 calculations in 3 or 4 minutes that an underwriter. What we want the underwriters to do is to be the thoughtful financial decision maker, not being the person just crunching numbers, to your point, Jeff. It's people who are evaluating what's the right business decision for the risk of this customer, and then listening to what the advisors say. Because if you're too busy talking about here's how we rated this, and you miss very important information and feedback about where the risk may be going. So we're really trying to create an environment where the calculations and the data get loaded in far more accurately and efficiently, and that the underwriters truly are financial decision makers, working closely with our account managers and our sales team and the advisors to get to the best possible answer long-term for the customer, not just immediate to sell the business.
That makes a lot of sense, because I think that's how some people probably think about it. Like this year, let's just figure out this year. Let's just talk about this year. But in actuality, this year is going to affect next year, is going to affect the year after. Jay, you had said something to me before we met today about technology and the role of technology in underwriting. I think that's what you're getting at here. But
Yes.
And for both of you guys, how has technology changed the process today?
What you want to leverage technology is in the most efficient and accurate ways, meaning there are things, again, where you can load data into all of your underwriting models with a human in the loop, but you have a digital coworker. Those things make you, again, more efficient in how you can provide data to the underwriters and to the customer. But you also, like AI is a buzzword, right? AI means so many different things. What we're really looking at is how do you leverage the best of both the state-of-the-art technology to come up with accurate projections, to staff the underwriter with more actionable data to make a better decision on behalf of the customer, the advisor, and Gravie. And sometimes that answer says, this customer really shouldn't be in a level-funded environment, right? They shouldn't be in a form of self-funding because their risk is too great. They may win in 1 year, but long-term, what's the right sustainable financial decision? So those are some of the actions we take and the information we share, because we want the customer to get to the best approach long-term and share that data with the advisor, who is ultimately the one that's going to help them figure out what plan designs and financial risk tolerance makes sense for them.
And how much variation, Jalaa, do you find from one carrier to another when it comes to underwriting? If you're, do you find that since the approach is pretty similar, that the results are pretty similar?
What I'm finding is there is some similarities, especially when you're in a marketing situation, right? So renewals come in, you go and look.
You compare column A to column A.
Compare column A to column A, put everything on your spreadsheets, right? We all have a spreadsheet. And as you're looking at things, I think carriers are very sophisticated at what they do, right? They're looking at the risk. They're seeing how that could impact based on whatever methodology it is they're using. And typically they're coming in pretty close to each other. There might be some differences here or there just based on, it's all variables, right?
Sure.
But overall, I see very similar approaches. What is helpful in an approach like Gravie uses is that I know how they've gotten to those numbers, whereas sometimes it's a little bit more hidden with other carriers, right? It's a little less transparent. And that's where it is on me to ask good questions of the carrier partners to figure out how we got that number. So again,
that's where that transparency comes
absolutely.
in. Yeah.
And I just need to make sure my clients understand, the why behind the numbers. That's really my job at the end of the day, is to bring them results.
And, to that point, I know, Jalaa, in previous conversations, you and I have talked about there's lots of forces at play. You're always putting together pieces of the puzzle.
Yes.
And there's pieces of that puzzle that you can't influence. There's other pieces you can, and, working with Gravie and our approach to underwriting, I imagine has changed the way you're able to play with those pieces. And I'm curious as to how.
Yeah, absolutely. So the market forces are going to be what they're going to be. A new thing is always going to become the trend. Like last year, it was inflation, right? Inflation was really kind of hitting into the healthcare space. And now it's a lot about the GLP-1s that are hitting the market. So it's keeping in front of those and then looking at the data that I can get for my clients to see, are we being affected by these particular market forces? Because that's going to keep changing, and it's changing at a faster pace. So it's me staying on top of what's going on in the market. So looking at the data that the client has, and then going back to the carrier to say, these are point solutions I'm thinking about. What new point solutions do you have? Can you help me with XYZ problem? Or have you done this with other clients where they have this, similar type of risk? And then it becomes a partnership conversation, right? Like, so we're all working together to meet the same goal.
Yeah. And, I imagine, Jalaa, that you and your other consultant colleagues at IMA are a bit of ahead of the curve. Are you finding, or I guess, Jay, you as well, are you finding that there is, broad understanding across the consultant community about the ways that you can collaborate and influence, or do we still have some work to do there? Do we still have some work to bring along the industry a little bit into this more collaborative approach?
I would say, we're really lucky. My colleagues and I, particularly in our Wichita office, we have great relationships with all of the carriers that we work with. So I think because we've always been more of the innovative kind of pushing the carriers, they've come along with us as we have moved through that process.
I think, there's always room for evolution and improvement. And what we're trying to really do is really be very proactive for our mutual customers. How do you help them? And we're going through the dynamic, you raised it earlier, of a high inflationary, high trend. And we feel it's lagging coming out of COVID. Particularly when you get into more of the middle market, the national account customers, they see it first. They're large enough, and they have, more specialized support internally and externally, both within their company and in the community. But the small and middle market customers see that lag. They may be in more rural areas, which all provide a further lag. So in a time of when you're trying to attract and retain your employees, it makes a bigger challenge when you have a high trend or inflationary environment. So you have to be out in front of that. And how do you do that very effectively with your carrier partners? So IMA does it. There are a lot of our partners that really push us, and we bring different solutions to the marketplace, but you have to always stay, trending forward, so to speak.
Yeah.
To stay ahead of the market trends out there.
What about accuracy? Let's talk a little bit about rate caps. With our approach to underwriting at Gravie being unique, we've been in market for a couple of years now with that approach. What are we seeing that translate to in terms of accuracy, Jay?
So I've been doing this a long time, Jeff. And so some of my colleagues at other companies may cringe, but when I was at my prior employer, we would reluctantly do rate caps, and we would have 23 different contingencies or caveats that would allow us to void the rate cap for two reasons. One, our confidence in how we do our underwriting. And two, we're a newer company, so we have to differentiate ourselves, just like we do with our plan designs, our service model, and our underwriting. Coming in with a rate cap demonstrates our confidence in how we have approached the group. And we offer rate caps on all groups over 50 lives where we have claim experience. So on those groups over 90%, we've honored the rate caps.
Wow.
And the other unique thing...
Jayla, is that impressive from your... that's a number that you don't probably hear often.
For sure. And I think a rate cap, and from my perspective, a rate cap is a great negotiating tool. And there are lots of reasons to put rate caps in place. I work with clients that have a defined contribution that doesn't change year over year. And so when an employee is going to take on whatever an increase could potentially be, a rate cap is important in that situation. So, in first year renewals, rate caps are, in my perspective, always important as well, because you're starting a new relationship, that client is. And so, they want to have some consistency for their employees as well. And changing carriers every single year is not an environment of consistency in any way, shape, or form.
No, it's scary for them. It's costly for them. They're making big decisions, particularly in the public sector. They have multiple decision-making entities, whether it's the management, the school boards for schools, the voters in a lot of those instances. So giving them that confidence and predictability, I believe, is really important. And you're going into this, you want a long-term arrangement. You don't want customers churning. The sales and acquisition costs for any carrier is extremely high. You don't want to write a piece of business and a year later or 2 years later lose it. The goal here is to accurately price it so they have confidence and you keep them for a multi-year.
Yeah, we're all just looking ahead. Let's think about what's coming next. You don't have crystal balls, but as you've been in this, both of you have been in this business for a long time. What can we expect to see in the next 5 years from an underwriting perspective, do you think?
So my and our vision at Gravie is, how do you combine underwriting on a more integrated basis with unique and differentiated products and plan designs, and with clinical programs, where you're not just throwing different things at an employer and you're not just confusing members. You're looking at it in a way that optimizes, as I said earlier, the financial stability for the employer. The employer wants that stability. They want to offer their employees good benefits, and they want to be able to sustain that. And it's so confusing still for the employees and their families. So how do you help them really understand, and how do you longer term put together how you underwrite, the plan designs, and the clinical programs at a family and member level to optimize their health?
Yeah, because it's funny as you say that, I'm having this aha moment where those three different kind of arms of a health plan organization live totally separate in most environments. You've got the plan design element, which is intended to, reel them in. You've got underwriting, which lives on its own little island about, how risky are these fish we're reeling in? And then you've got this clinical nav arm that's like, once they're in, let's make sure they're swimming in the right direction. And I think what you're talking about, pardon the fish analogy, is making that all part of one centralized nucleus, right? That works together instead of in three different paths, which just makes a lot of sense.
Yeah, and we've already started that journey and have been building through our underwriting workbench and working with our clinical teams and working with the product strategy teams on how we do that. People tried this years ago with cafeteria plans. The problem is they let the decision making to the employer and to the employees with all these different modular benefits, and it was just overwhelming. Again, back to the analogy of a financial advisor who says, what's your risk tolerance? Where are you in your state of financial? Are you earlier in your career? Do you have small children? Are you getting ready for college? Are you getting ready for retirement? If you have working with an advisor, you can come up with a risk strategy that meets their needs based upon where they are and their health risk, as you would with, your portfolio from a financial well-being. We want to ensure not only we optimize their health, but that's also part of their financial well-being.
I mean, it's a great point. It's not
well.
lost on me that, people tend to when you think about your 401k, when you think about your IRA, when you think about your 529s, you're not thinking about year over year. You're thinking 15, 20, 25 years. But with underwriting, traditionally, you're thinking year to year, which is, and so I appreciate the distinction you're making.
Well, and from a member perspective, right, you don't access the healthcare system until you need it.
Right.
And that's the whole point of having insurance anyway, right? Is it's that thing to fall back on. And so, to this idea, something you said made me think of, when they go and access the healthcare system, and then if issues come up because a point solution got put in that is, has member disruption. And even though it was talked about, those types of things I think are going to continuously start to happen as we move toward the future because we're getting more sophisticated in how we can look at data and we can pinpoint specific areas that we know that we can work to try to kind of bend the trend, if you will. And so I think it's going to be important looking into the future, again, getting into this differentiation of what is the risk, what does it look like going forward, because everything is going to be changing so quickly.
Well, Gravie made a huge, I would call investment, right? They did something that I always wanted to do in my prior life, but everybody was, well, that sounds really great, but that's really risky. The comfort plan designs and really taking away the barriers to
copays, deductibles,
to healthcare, and being able to underwrite and assess that risk is the probably first three major steps. But it's to get people along the path where they're getting the care they need long term so that their financial well-being is optimized. And again, their employer's financial well-being is being taken care of as well. So that's, it's a very thoughtful path and approach that we're on to try and do things differently, particularly in this segment where people often make a decision if they're in a high deductible health plan. Am I going to pay my rent or am I going to buy groceries if I have to go get this care?
Yeah, I mean, a high deductible health plan, for all of the values it adds, it does create a little bit of a Sophie's choice for a lot of members, doesn't it?
Absolutely.
It does.
I joke. So I started in this industry in the wellness space. So I joke I'm a recovering wellness advisor. But that's really important because what the comfort plan does in reducing financial barriers is what the wellness community has been trying to do for a lot of years. Get people to their physicians, let their doctors start catching things early, helping to manage so that smaller conditions don't become larger conditions as time goes on. And so I think that's a really unique value add in and of itself, let alone all the other value adds that might be included, with, partnering with a carrier like Gravie. I think that's a really important distinction.
Yeah. And just for our listeners who might be unfamiliar with Gravie's flagship product that's called Comfort. Comfort is a plan that basically there's zero copays and zero deductibles for about 90% of healthcare services. And the idea being that it's, a benefit, a health benefit should mean that you have coverage for the things you know you're going to need. I think the traditional thinking around health plans is that it's for catastrophic, you need it for the unexpected. We flipped the script a little bit and said, well, why are we insuring against the unexpected? We can do that, but let's do it in a way that also makes sure that the expected, the things you should do, which by the way, will ultimately keep you healthier and keep some of those unexpected costs at bay. Why not make that no barrier to entry. On a podcast that we aired in 2 months ago, we talked a lot about the invisible uninsured being employees who work in small and mid-sized businesses. People tend to equate the word access with the uninsured, but there's a lot of insured people who also have access issues because of the costs of out-of-pockets, of copays and deductibles.
Yep. And I think what's important about that too is, employers want to offer benefits where they're reducing those barriers and employees get the care that they need. And what I think is great about Gravie's approach is that and with your approach to underwriting, that you're able to price it so that those things are accessible to small and mid-sized employers where maybe they wouldn't necessarily have been before.
So Jalaa, from let me take that train of thought with small, mid-sized, larger employers. Does Gravie's approach to surgical underwriting work for employers of all sizes? I know right now Gravie tends to focus primarily on small and mid-sized businesses for the very simple fact that those are the groups that are most often left out by traditional carriers.
Yeah, absolutely. So for sure, yes. I definitely think the approach matters because one, a small, 50 life group, a 75 life group, one or two individuals that have really high claims and conditions that are driving those can really skew, a loss ratio and can skew how a carrier is going to trend that forward, in Jay's words. And so, I think it is important to come at it from a transparent standpoint, just because then again, it comes back to helping the client understand. And at the end of the day, I need to be able to share a story with them and being able, the one employee here, one member having this is really what's driving this. And while they can understand that, it's really nice to be able to say, and here's how we're going to approach it moving forward.
So that we don't let that one or
Right.
two employee affect everybody.
Right.
Yeah. So do you think there's a re-education among the benefits community that has to take place?
I don't necessarily think that because, the from the Gravie platform standpoint, it's a level funded. It's a version of self-funding, right? And there's a lot of motion by employers to try to get self-funded in some way, shape, or form, right? It's a long-term cost reduction philosophy. For small and mid-sized employers, the best way we can help mitigate increases is, by pulling levers of stop loss. And so it's what, individual stop loss level are we looking at? And then secondarily to that, how are we helping you budget so that we're not looking at just claims at expected, we're looking at claims over a percentage of expected. So I think that's the core of good consulting with, smaller to mid-sized clients. And then you can pair that with, here are point solutions that are value adds as part of your plan design. Here, is another way that we can look at this and give them multiple ways to think about how we're managing their plan and then bring in a good partner that can help meet those goals that you've talked about with that client.
Yeah, and I should note for our listeners about Comfort also that the vast majority of Comfort members are level funded, and that stop loss is so important. So Jay, to what degree does our approach at Gravie to underwriting not work in a level funded stop loss environment? Is it more specific to that kind of plan design, or do you think that there's different ways that underwriting can happen even in the fully insured market, and in self-funding outside of level funding?
Well, there's really a number of different things that go on that allow, the advisors like Jalaa to evaluate the risk. And there are differences in how we approach level funded, right? One of the big differences is the surgical forward-looking underwriting approach. Fully insured carriers, they look at their overall book of business. They do some blending with their book of business when it's a fully insured. So if there is a customer who has higher risk characteristics, fully insured may actually work better for them. Mm-hmm. That's what Jalaa and her peers around the country are evaluating. What is the best sustainable approach based upon their evaluation of the risk? There are a lot of advantages of a level funded. Level funded, though, works until you have a very big claim
Right.
that's going to be ongoing.
It's going to tip the balance. It's going
Right?
to tip the scale.
And then, we drive our spec deductibles to lower levels because it makes the spec more predictable, and it also makes the aggregate claims, the day-to-day claims, more predictable if you're a lower spec deductible. And we then work with the advisor who knows the risk tolerance of the employer the best. Is this employer is a little bit more sophisticated. They are willing to take on a little bit more risk. That's the advice and teamwork we're trying to really establish to understand that. But we try to drive things lower because it drives that sustainability. And I've always had a personal challenge, I will say, that, a lot of times carriers will come out with a rate increase, and they'll buy down the rate increase by raising the spec deductible, meaning they're basically shifting risk
from one
to
place to
the
another.
Entity that is least qualified to manage the risk. That's the employer. That's where Jalaa and her peers come in and say, no, that's not the right decision for this. We try to go in the opposite direction because we feel it is sustainable, until we're told that this group can support a higher risk profile.
Well, let me give you each the last word here. And I'm curious, knowing that folks listening to this podcast today are most likely either benefits consultants and advisors or employers who are responsible for evaluating and selecting health benefits for their workforces. What do you want them to know? What as they think about how they can be the best at their jobs, how they can be current and future forward, what do you want them to know?
I mean, from my perspective, my job is to be a business partner to my client, and it's building trust and being transparent about what's going on in the market, what's happening within the risk within their plan. Here's new and emerging trends we're seeing, and here are potential solutions to help address those emerging trends. And so getting to work with partners like Gravie makes that an easier process for me. And it gives me some credibility with my clients too, right? Because they know I'm coming with, transparent, honest, the best that I could get for them, numbers and programs. And at the end of the day, they're here to serve their employees and their employees' families. And so that's what's most important to me as a consultant in kind of this little market we're in.
Yeah. Jay?
Well, I think, it's sort of very similar to what Jalaa just shared. We're really trying to provide the best solution for the employer and their employees, working in a very transparent or partnership approach with them and their advisors. And partnership can be an overused term in our industry. If you're not willing to share data and different views, we know our solution isn't necessarily the right solution for every customer, but we want to go into that showing them what we really truly think, giving them an honest answer to their questions and demonstrating that through the analysis we've done and our ability to really stand by it. And that way, the advisor can make the most informed decision, right? You don't want to go in and oversell or position things inappropriately where it just comes back to...
Because then they'll find a new consultant the next year.
They'll find a new consultant.
Or a new carrier. Or it could be both.
Yeah. It's like, let's think long term here.
Yes.
I think that's an undercurrent of what I'm hearing from both of you is like, this is about thinking long term,
Yes.
and it's taking an industry that tends to think in renewal cycles and thinking instead about the future.
Yeah.
Well, it is. And it's really trying to just build confidence in an industry that doesn't have a lot of trust.
Yeah. If your advisor doesn't trust the carrier, then certainly the employers are not going to either.
Right.
And they're going to give us feedback, right? We won't do everything perfectly, but they know we listen to their feedback.
Yeah.
And we know we don't always have the best answer for the customer, but we have the best intent to really get to the right data to share that.
Well, for me, as someone who's worked in and out of health plans for the past 20 years, it's been super exciting to see at Gravie how we're looking at the same old problems with a very different lens. And I think that's what's needed in this space. If you think about, for all the disruption that's happened in the broader healthcare industries that marketplaces have brought, there's been very little disruption in the group market of health benefits. And I think we're starting to see a little bit of a turning of the tide there. And hopefully, as more advisors and consultants like Jalaa and your colleagues at IMA, as more plans like Gravie stand up that focus and prioritize, staying well and thinking long term, I think the more we will be able to really change some of that trust you're talking about. It's going to take time, certainly. I mean, we are where we are today after decades and decades of the same old. And so it's exciting to see this new kind of thinking, particularly applied to something that is so fundamental and traditional about the business, meaning the assessment of risk. So Thank you both so much for being here today. Super fun conversation. Most people wouldn't use the words fun and underwriting in the same conversation, but we're a unique bunch, and I've enjoyed it, and I really appreciate your insights. Well, it was great to get Jay and Jalaa's perspective so we could hear more about the different levers that benefits consultants might be able to pull when it comes to underwriting, how they can be more collaborative with the underwriters, and ultimately how we can be evolving the ways in which risk is assessed to help better meet the future needs of small and mid-sized businesses. A huge thank you to Jay and Jalaa for joining us on this episode of It's a Gravy Thing. If you'd like to learn more, head to gravy.com. It's a Gravy Thing is produced by Gravie in partnership with Pod People. Thanks so much for listening. And if you liked what you heard, rate and review the show. And of course, subscribe to It's a Gravy Thing to make sure you never miss out on a new episode.